breast cancer. It's a health challenge that touches so many lives, a really significant issue for women everywhere, actually.
Yeah, absolutely. And we're seeing rates increase, especially in, well, developed nations. It's concerning.
It really is. But beyond just genetics, which often comes to mind first, there's this other powerful factor, one that's actually quite accessible: exercise.
Precisely. And we're not talking about, miracle cures or anything like that. It's about exploring the really strong connection that research shows between physical activity in all its forms and this disease.
Right.
We have some compelling studies showing how movement impacts risk, how it can affect treatment outcomes, and how it supports recovery afterward.
Okay, so that's the core of what we want to unpack today, right?
Yeah.
How does exercise actually do that? What's happening inside our bodies when we move that makes such a difference with breast cancer?
Exactly.
And maybe more importantly for people listening, how can we, bring more movement into our lives, not as some kind of chore, but as a real tool for better health?
Well, that's the goal for this deep dive. We want to break down the science behind this link. We'll look at the known risk factors for breast cancer, dig into the cellular level changes that exercise triggers.
Okay.
We'll identify who might benefit the most from this protective effect and explore the role of activity both during treatment and after.
And we're drawing on research reviews for this.
Yes, comprehensive reviews. The aim is really to pull out the clearest, most actionable insights for you.
Great. So let's start at the beginning then. How does breast cancer even start? What's the basic process?
Well, it's complex, as you'd imagine. It's usually a mix of things, genetic factors, hormonal influences, and environmental exposures.
Okay.
So genetically, you might have heard of BRCA1 and BRCA2 genes. They're involved in DNA repair.
Right. Those mutations increase risk quite a bit, don't they?
They do, significantly, because errors in cell copying are less likely to get fixed. But it's important to remember that these inherited mutations only account for a fairly small percentage of all breast cancer cases.
So for most people, it's not primarily about those specific genes.
Exactly. Hormonal balance is another big piece, particularly a woman's lifetime exposure to estrogen.
Okay.
And then you've got these environmental factors, things we can potentially modify. Diet, whether or not you breastfeed, alcohol intake, and crucially for us today, exercise.
Right. So exercise fits into that modifiable category. But how, going for a run doesn't change your BRCA genes.
You're absolutely right, it doesn't change your DNA. Where exercise makes its mark is by influencing those environmental risk factors. It helps regulate hormones, and it's really key in reducing inflammation throughout the body.
Ah, okay.
So it basically helps counteract some conditions that might otherwise encourage cancer to develop.
Got it. So it's about making the body sort of a less welcoming place for cancer cells.
That's a good way to put it. It works on a fundamental level.
Okay, let's go deeper then to that cellular level.
Yeah.
The research you mentioned highlights obesity and fat tissue adiposity quite heavily. Why is that so central?
Yeah, this is where it gets really interesting. Obesity itself is a major risk factor for many cancers, not just breast cancer. It's linked to maybe 15 to 20% of all cancer deaths.
Wow, that's substantial.
It really is. And specifically for breast cancer, there's a clear correlation shown between excess weight and developing it, especially in postmenopausal women.
Ah, so specifically postmenopausal.
The link is strongest there. That direct connection hasn't been quite as clearly established in premenopausal women, though maintaining a healthy weight is obviously still important overall.
That's a really important distinction. So the connection seems particularly strong after menopause.
Precisely. And the encouraging part here, of course, is that unlike your age or when you start menopause, body weight is something you can influence. It's a controllable risk factor.
Right.
And the research points to, well, 3 main ways excess weight might contribute to cancer growth. First is insulin resistance.
Oh, how does that work?
Well, when you have obesity, your body often doesn't respond to insulin as well. This can lead to higher levels of insulin circulating in your blood. And these high insulin levels can actually act like fuel, stimulating cancer cells to grow.
So it's like giving them an extra growth signal.
Sort of, yes. And exercise is brilliant here because it makes your muscles more sensitive to insulin, helping them take up glucose more effectively.
So you need less insulin overall.
Exactly. You avoid those high circulating levels that might encourage cancer cells. The second mechanism involves fat cells themselves. They're not just storage depots.
Right, they're active.
Very active. They release signaling molecules called adipokines. Some of these, like leptin, can promote inflammation and cell growth. Excess weight often means chronic low-grade inflammation, which isn't good.
And exercise counters that inflammation.
Yes, regular activity helps lower those pro-inflammatory markers. It calms things down.
Okay. And the third way?
The third way is something called adipose tissue hypoxia, basically low oxygen levels within the fat tissue itself.
Low oxygen in fat.
Yeah, if fat tissue expands rapidly, the blood supply might not keep up. This low oxygen environment can trigger more inflammation and create conditions that cancer cells actually thrive in.
Huh. Hadn't heard of that before.
It's a factor. And exercise helps here too by improving circulation and ensuring better oxygen delivery everywhere, including fat tissue.
Okay, that clarifies the weight connection a lot. What about hormones directly? Like estrogen, we hear a lot about that.
Absolutely. Estrogen plays a vital role in normal breast cell growth. But the research shows that too much estrogen, especially over a long time, can actually damage DNA, and that increases cancer risk.
Okay.
Now, here's a key point. After menopause, when the ovaries significantly reduce estrogen production, guess where most of the body's estrogen comes from?
Let me guess. Fat tissue.
Exactly. Fat tissue becomes the main source. So if you reduce body fat through exercise, you can directly lower your circulating estrogen levels.
Right. Less fat tissue, less estrogen after menopause, lower risk. Makes sense.
It's quite a direct link. It highlights how important healthy body composition is, especially later in life.
And the sources also mentioned oxidative stress. What's the role there?
Yeah, so oxidative stress is basically an imbalance. Too many damaging free radicals, not enough antioxidants to neutralize them. Cancer seems to thrive in that kind of high-stress environment.
Okay.
Now, moderate exercise, and the emphasis is on moderate here, seems to actually reduce overall oxidative stress and boost our body's own antioxidant defenses.
So it helps protect cells from damage.
It helps strengthen those protective mechanisms. It's about finding that balance. Regular activity promotes cell health, but you don't want to push into excessive stress either.
Okay, so pulling all that together, it really sounds like exercise works on multiple fronts. It reverses or improves many of these underlying biological conditions that could raise breast cancer risk.
That's exactly it. It's not just one thing. It's improving insulin sensitivity, reducing inflammation, improving oxygen flow, helping balance hormones, even protecting DNA indirectly. It's a package deal.
Which leads to the next logical question. Does everyone benefit equally? Or are there groups who see an even bigger impact from exercise?
That's a great question. The research suggests a few things. Menopausal status is definitely a factor.
Right, you mentioned the postmenopausal link being stronger.
Yes, because of that estrogen production shifting to fat tissue, exercise often shows a particularly dramatic risk-lowering effect in postmenopausal women.
That's really key information for that group. Any other differences?
Well, some studies suggest that women of color might experience even stronger protective effects from exercise, though more research is always ongoing there.
Interesting.
And another interesting point from the research is that exercise shows a really significant risk reduction benefit even in women without a family history of breast cancer.
Well, that's important because sometimes people think, oh, it doesn't run in my family. I don't need to worry as much.
Right, but that's not the case. Most breast cancers aren't linked to those specific inherited genes. So exercise offers this broad protection.
Good to know.
The main message, really, is that all women stand to benefit from exercise in reducing their risk factors. Some groups might see slightly larger effects, but it's beneficial across the board.
So genuinely a powerful prevention tool. Do the sources give any, specific numbers on risk reduction?
They do, and there's a pretty clear trend. The more you exercise, generally, the lower your risk.
Okay.
For postmenopausal women, the reviews mention risk reductions ranging quite widely, actually, anywhere from 20% up to even 80% with consistent activity.
80%. Wow, that's huge at the top end.
It is, though that likely represents very high levels of activity. For premenopausal women, the effect might be a bit smaller, but it's still definitely there. Overall, looking at all women, exercise is linked to roughly a 15 to 20% lower risk.
Still very significant numbers. And does it matter when you start? Does being active younger help?
Absolutely. The research suggests that activity during childhood and your teen years can contribute to prevention later on. It likely helps by keeping body fat levels lower throughout life and maybe reducing that cumulative lifetime exposure to hormones. It really speaks to building healthy habits early.
Makes sense. Now, are we talking specific types of exercise here? Do you have to run marathons?
Not at all. The reviews looked at different types. Recreational activities, hobbies, fun stuff, and even household chores were linked to up to a 21% risk reduction.
Household chores. Seriously.
Yep. Keeping active around the house counts. Occupational activity, so having an active job, showed about an 18% reduction.
Okay.
And even just walking or cycling for transport was linked to a 13% lower risk.
So it's not just about hitting the gym. Everyday movement really adds up.
That's a crucial takeaway. And the idea that more is generally better seems to hold true.
How much more?
Well, some studies suggested that even just 2 to 3 hours a week could cut risk by about 7%. Bumping that up to around 6.5 hours a week was linked to almost a 30% reduction.
Okay, quite a jump.
Yeah. And there was a slight edge for vigorous exercise, like running maybe a 26% reduction compared to around 22% for moderate activity, like brisk walking. But both are clearly beneficial.
So the main thing is consistency, making it a regular part of life, whether it's moderate or vigorous activity.
Exactly. That sustained activity over time seems to provide the biggest benefit.
Okay, let's shift gears a bit. What about during breast cancer treatment? That's often a really tough time physically. Can exercise actually help them?
Yes, definitely. Treatments like chemo and radiation can have some really rough side effects, as you know, but the research is quite clear that exercise can be incredibly valuable during this time.
How so?
Well, it can help fight that debilitating fatigue that so many patients experience. It also helps combat muscle loss, which can happen with treatment and inactivity.
That makes sense.
And importantly, exercise might help reduce the risk of cardiotoxicity heart damage, which can sometimes be a side effect of certain chemotherapies.
Wow, protecting the heart during chemo, that's huge.
It's a really significant potential benefit. Plus, exercise helps with weight control, which can be challenging during treatment, and it can help maintain bone density, which some treatments affect.
And mentally.
Oh, absolutely. It's shown to improve mental health, reducing symptoms of depression and anxiety, which are understandably common during diagnosis and treatment.
So it supports the whole person, really. Physical and emotional resilience.
Exactly. The bottom line is that appropriate exercise during treatment can really minimize side effects and significantly improve a patient's quality of life.
And what about after treatment? For survivors navigating life post-cancer, does exercise keep being important?
Absolutely crucial. Many survivors deal with lingering issues, fatigue that doesn't quite go away, maybe weight gain, sleep problems, joint pain.
Yeah, those can really impact quality of life long term.
They can, and staying active helps manage all of those things. The best approach often involves a mix.
A mix of what?
Aerobic exercise, think walking, swimming, dancing for heart health and fatigue, and resistance training weights, body weight exercises to rebuild strength and muscle mass.
Okay.
Things like yoga, Pilates, maybe even some forms of HIIT can also be really beneficial for flexibility, balance, and overall well-being.
So finding a routine that covers different bases.
Exactly. And critically, staying active after treatment is also linked to a lower risk of the cancer coming back.
Really? That's powerful.
It is. It's about supporting long-term health and recovery. But of course, and the research always emphasizes this, survivors should always talk to their doctor or a physical therapist to create a plan that's safe and right for them.
Definitely. Safety first, always. This has been so insightful. Okay, so for someone listening right now, maybe feeling a bit overwhelmed but wanting to start, what are some simple, actionable first steps?
Yeah, keep it simple to start. The research suggests daily walks are great. Even just 20 minutes makes a difference. Some evidence even hints walking after meals might be particularly good.
Okay, a post-meal walk. Easy enough.
Try adding some strength training. It doesn't have to be heavy weights. Body weight stuff counts. That helps with the estrogen levels we talked about.
Got it.
And, this is important too, limit alcohol. It is classified as a carcinogen.
Right. That's a separate but related lifestyle factor.
And maybe the most important tip, find something you actually like doing. If it's fun, dancing, hiking, joining a team, whatever, you're way more likely to stick with it. Consistency is the magic ingredient.
Make it fun, make it sustainable. Love it. So really wrapping this up, the message from the research seems crystal clear. Exercise is this incredibly powerful tool against breast cancer.
Absolutely.
And it's something entirely within our control, which is empowering. Whether it's reducing your risk in the first place, helping you get through treatment, or supporting your long-term recovery, getting active makes a real difference.
It truly does. So the challenge for you listening is maybe just to think about one small change you can make today. Maybe park a little further away, take the stairs, just move a little more.
Yeah, start small, build from there. Your body will definitely thank you for it.
It will, now and down the road.
You know, thinking about all these ways exercise works on hormones, inflammation, DNA protection, oxygen flow, it makes you wonder, what other lifestyle factors might have similarly powerful, maybe sometimes overlooked, effects on our long-term health? Definitely food for thought.
It is indeed.
For everyone listening, we really hope this deep dive gave you some valuable, practical insights into this vital connection between movement and breast cancer prevention and recovery.